Welcome to the Functional Medicine Radio Show with your host, Dr. Carri Drzyzga, known internationally as the Functional Medicine Doc. Dr. Carri is committed to helping patients find the root cause of their health problems and fixing the cause with natural treatments so they can feel normal again. Dr. Carri is the founder of Functional Medicine Ontario and is the author of the hit book, Reclaim Your Energy and Feel Normal Again. Please welcome your host, Dr. Carri Drzyzga.
Hello, everybody, and welcome to the Functional Medicine Radio Show, the only internet radio show dedicated to giving you real solutions to improve your health. Not only are they real solutions, but they're natural solutions as well. Because as you know, the one and only true wealth you have is your health. I'm your host, Dr. Carri Drzyzga, the Functional Medicine Doc, and I'm committed to helping you find the root cause of your health problem, fix the cause with natural treatments so you can feel normal again and live your life to the fullest. Just a quick bit of housekeeping before I introduce today's special guest. I'm happy to announce that I'm now working on my third book. The title is Reclaim Your Digestive Health and Feel Normal Again, Fixing the Root Cause of Your GI Distress with Natural Treatments. That's it for housekeeping, so let's get started. I'm very excited about this week's show because my special guest is someone that I greatly admire. Her name is Nadine Artemis. Let me tell you a little bit about her. Nadine is the author of Holistic Dental Care, The Complete Guide to Healthy Teeth and Gums. She is a creator of Living Libations, an exquisite line of serums, elixirs, and essential oils for those seeking the purest of the pure botanical health and beauty products on the planet. Her potent dental serums are used worldwide and provide the purest oral care available. Nadine, thank you so much for being my special guest today on this episode of the Functional Medicine Radio Show.
Hello, thanks so much for having me on.
So Nadine, first I wanted to kind of explore about what is really going on with toothpaste and toothbrushes and mouthwash. I've read on the internet that we have these little micro beads of plastic in toothpaste. I mean, tell us about all of the crap that is in there.
Well, it is fascinating because never before on the planet have we had so many choices. And you can walk down those drugstore dental aisles and there's, countless solutions and countless tubes of paste. And but still, right now, there is a staggering number of cavities, crowns, root canals, and extracted teeth. So we know that something's amiss because even though we have this whole plethora of periodontal promises ranging from triclosan toothpaste, fluoride floss, and minty mouthwash, there is now more dental decay and dysbiosis than in any previous century. So one of the things we have to look at is what's going on with these commercial products that contain sodium lauryl sulfate, glycerin, triclosan, plastic beads, all these really harsh things. And so what I find fascinating, from skincare ingredients to toothpaste ingredients, we could totally go through, the horrors of sodium lauryl sulfate and triclosan each individually. But, that can be Googled, and I have
if you can give us the broad brush strokes.
I could do the broad brush, but what I really want to get to the root of is, besides all these individual ingredients, and also I have an article on my website that will go through those a bit, but what we really want to understand from this is how that harms our mouth's microbiome.
So tell us about the microbiome. We're hearing more and more. It's so exciting. All of the research that's coming out, for geeks like me, all of the research that's coming out about how important the bacteria that live in us and on us are for our health. There's a lot of research right now about gut health and all of the good, friendly probiotics in the gut. But we know that, I should say me as a functional medicine doc, I know that oral health is also really important for your overall health. And so today we're going to talk a little bit about the good friendly bacteria that should be living in our mouth too.
Yeah, it's totally fascinating. And I feel like there's two root things to really understand about the mouth, which is the microbiome, which we're going to totally dive into. And then maybe after that, we'll visit the dentinal lymph system, which is the lymph system within the teeth. And so I think when we understand that, we can really undo and go, oh my God, I get it. Rather than just like go see the hygienist and brush your teeth.
And floss, yes.
Yeah, and floss. So, as you know, and I'm sure you're going to have a lot about this in your new book that's coming out, but the microbiome is the term for the colonies of the trillions of microbes that live all over our skin, in our guts, and in our mouths. And of course, there's even other areas like the nose, the ear canal, and for women, the vagina is another very important microbiome area. So the study of the human microbiome is revolutionary. And it's really been getting strong in the past decade. So where the 90s were this about the DNA and the genome, now what we know is we're almost in a post-genomic era, because what we now know is, sure, we got our DNA and genes, but what's more important is the DNA and the genes of the trillions of microbes that our body is dependent on. And this microbiome enables endless essential body functions. And now we know that we're actually 90% microbial and only 10% mammalian. So we are host to this bacterial banquet, and the key to the vitality of our mouths is bacterial balance. And what's been going on with modern dentistry is that we've been disrupting the beneficial bacteria in our mouths, and that many practices of dentistry and then many commercial oral care products actually mutate the mouth's microbes. And so what we want to do now is really reconcile with this bacterial community in our mouth, and we need to abandon the products and practices and the antibiotics that are really making our microbes mutate, modeling teeth, and deforesting, what I call deforesting the flora of our oral ecology. And so what we can see is that we really need to almost create a microbetopia in our mouths. So to clarify or to summarize, the sort of triple threat to our mouths are these harmful procedures and this lack of understanding about the dentinal fluid, which we'll talk about more, and this periodontal scorched earth policy that we have on bacteria. The Listerine, the antibiotic mouthwashes, the triclosan, and the toothpaste. And this trifecta is creating the perfect periodontal storm that's fostering receding gums and this entropy, this dental decay. And then on top of this, we have a system that's really creating these Band-Aid solutions, which of like bleaching and gum grafts and veneers and fillings. So instead of understanding the root of the issue, instead of befriending those bacteria, we're literally just like ignoring that and then just doing the bleaching and the gum grafts and all that on top of this. And then besides all the whole dental world and that whole issue, we've got other things that are taking away from our mouth's microbes, including antibiotics, because antibiotics for one disease could affect the teeth. Antibiotics like triclosan and help me with that one, ciprofloxacin.
Ciprofloxacin.
Yeah, thank you. It's devastating when you see the results of what that does to our teeth. And, that's not an antibiotic that would have been prescribed at the dentist's office per se, not necessarily, but, you might be doing it for ear infections in your kid, and then they're growing up with these mottled teeth and that kind of thing. So what also that brings into play is that we can see the devastating results from the not understanding how our teeth function, and that they're intimately connected to the body, the bloodstream, and the lymph. And when we really understand that systemic connection, then we can see how medications and chemicals such as antibiotics and fluoride, yes, fluoride, actually contribute to brittle, discolored, even crumbling teeth by suppressing this dentinal lymph system. And that affects bone mineralization, nerve health, and saliva pH and endocrine function. So we can just see the whole thing is really deeply connected, and that a lot of our dental solutions are causing this full disruption in our mouth. Because, for example, when we look at specific bacteria, we can see how Streptococcus mutans, for example, which is a cavity-causing bacteria, that actually exists in everybody's mouth, whether it's healthy or not healthy. Everybody has that bacteria. Just like I'm pretty sure everybody's guts has E. coli somewhere in it, and just depends if you have a lot or if you've eaten something that's got E. coli on it, and then those pathogens can create momentum. So we all have the Streptococcus mutans in our mouth, and what the research is showing now is through our modern practices, which are making us lose some of our microbial species, that these pathogenic bacteria can gain more traction. And so scientists are now figuring out that what's making Streptococcus mutans more virulent is that it's missing its ancestral bacterial buddies, sort of the ones that will keep it in check. So that pathogen is only going to cause a problem in the mouth when it can begin to form a biofilm, and then that adheres to the tooth surface. Normally, these pathogens, we'll always have pathogens in our body, and they exist in a free-floating planktonic state. But when they grow in numbers, then they're able to gain traction by communicating through something that scientists call quorum sensing. That's with a Q, Q-U-O-R-U-M, quorum sensing. And that enables them to colonize into these biofilms, which is then where they can build the communities and cause more disruptive plaque. And so the quorum sensing is the way that the pathogens begin to communicate, and they start to coordinate their group behavior and regulate their gene expression. And so then the biofilm forms, and it's a densely packed colony of microbes that adhere to the surface of the teeth. And then the biofilms start to then surround themselves with these sticky secretions, which is like a mucopolysaccharide plaque layer. Don't worry about the big words, but it's just this more of a plaque layer around the biofilm colony that forms another barrier that's completely impermeable to antibiotics. And yet we still get antibiotics even prescribed for oral disease. So then when you have this dental plaque, it's a biofilm, it can entrap the existing pathogens, and they hide. It makes the pathogens hide from the alkalinizing saliva flow. So, and then you just sort of start this whole snowball effect, and then the teeth can't breathe anymore, and then that prevents the saliva and then this dentinal lymph from doing its job of cleansing the teeth with a protective coating. So then things like, going back to the ingredients in toothpaste, they generally, and this is very generally speaking, but things like sodium lauryl sulfate make the gums bleed. Mercury fillings make the gums bleed. So then you've got these toxic chemicals that are mutating the microbes, going into the bloodstream, which is going to also then go into the guts. So then we might have digestive health issues because of what we're doing in our mouth. Obviously, the mouth and the stomach are very connected. We just start this whole ball of wax, and meanwhile we think we're doing this minty fresh thing, and we might sort of feel like our mouths have been shocked into this freshness, but it's a false freshness because it's disturbed the microbiome. And even before we knew about the microbiome, we knew that these ingredients were disturbing the very thin skin in the mouth, the epithelium, which is only 1 cell thick, and contributing to things. So the ingredients there, it contributed to things like receding gums. And it can go on and on from there.
So Nadine, you've mentioned a few times already about the lymph system. Can you talk a little bit about that, in simple terms too?
Yeah, for sure. It's one of my favorite things to discuss, because what we need to understand is that since the 1940s, what the American Dental Association decided upon and then sort of spread throughout the kingdom, so to speak, through dental schools and dentists, was this acidogenic theory. And that's what sugar and acids on the teeth contribute or create cavities. And that's just not really how it's done. And that's been proven scientifically since then by other dentists. So all the research that I share is from dentists and scientists. So there's many dentists that will be, you know what I mean? So it's not like I invented this, and it's revolutionary, but many biological dentists that's totally what they understand as well. And so I have lots of dentists to back me up, so to speak. But what we need to really understand is that acid and sugar on the teeth are fine, because if the teeth are strong. And what we really want to understand is how decay happens, so then we can really see how our teeth are alive, and that they are alive bones, and that we can remineralize them, and we can change the health of our mouths no matter what state it's in today, because our mouths are alive, they're a part of our body, and they're going to respond. So what we want to understand is that teeth are fed from their roots by this dentinal lymph system. Just like tree roots draw up nutrients via the sap, the dentinal lymph flow is a toroidal system, and so the lymph liquid spins inwards and upwards into the tooth's core, and the tooth's core is called the pulp chamber. So the dentinal lymph flows through the tooth and out onto the enamel like microscopic sweat. There's tiny droplets that coalesce on the surface of the enamel, and that forms a fluid layer that prevents biofilm formation and mixes with the saliva to lubricate and communicate to the mouth's microbiome. But when the dentinal lymph secretion, or sorry, there's no but there, but when we have this dentinal lymph secretion and it's properly functional and our body's working with it, then I like to call it an invisible toothbrush, because when the dentinal lymph flows and we have this juice, so to speak, that's going into our tooth and out into the enamel, out into the mouth, then we prevent systemic decay. We inhibit the penetration of pathogens, and we neutralize acids on the tooth surface. And here's where the but comes in. So if we're eating a diet of processed food, sugar, carbohydrates, if we have a lot of chemicals and medication in our lives, if we have a lot of stress that then takes its toll on the endocrine system, the hormone system, then the dentinal lymph flow can actually stagnate. So it can get to a neutral, stagnant position, or what's even less good is that it could actually fully reverse. So it's not going into, so it can either flow into the teeth, it can just stagnate, or it can actually reverse. And when the reversal happens, then capillaries in the tooth suck in bacteria and other microbes from the mouth into the tooth like a straw. So the capillaries are sucking into the tooth like a straw, the bacteria and the other unwanted microbes from inside the mouth. And then this can cause infection and plaque formation within the pulp chamber and within the tiny dentin tubes in each tooth. So then this, what is supposed to be, a self-cleansing system, actually becomes a self-contaminating system. And then that causes what I like to think of as like a leaky tooth. So if we think of leaky guts, then we have a leaky tooth situation on our hands. And that is actually the genesis of cavity creation. So a cavity is actually an infection in the tooth, and like all wounds, it has the ability to heal because teeth are alive, and we can change the condition of our mouths. And then some of the dentists that have really spent their whole life helping us understand this are dentists like Dr. Ralph Steinman, and he scientifically proved the dentinal lymph system with thousands of experiments. And he also showed that just by including dietary magnesium and phosphorus into the diet, then decay rate was reduced by 86%.
Oh, wow.
Yeah, and then another doctor, Dr. Melvin Page, further confirmed this. They were working separately, but he found that when phosphorus levels, blood levels dropped below 3.5, then cavities began to form. And then Dr. Weston Price, who was the former president of the American Dental Association in the 1930s, Dr. Weston Price concluded that fat-soluble vitamins of K2 and D3, which is, found in sunshine or pastured dairy and eggs, so that means not pasteurized, but pastured, so that the chicken has eaten grass, or that the cow, from the butter from the cow, the cow's been eating real grass. So with our current situation of factory farming, there's no K2 being produced in your dairy or eggs because it needs the sunshine to make that. The grass, the sunshine, and that whole system is making K2 in the food. And that's when you get the more orange egg yolks, more orange butter, that kind of thing. The orange is the K2, that orange color pigment. So he found, though, when those K2 and D3 were included, then that also inhibited decay. I think the stat is around 40%. And we're talking about reversing and inhibiting. So what we also can see from this is that fillings are really Band-Aid solutions. And when we put in a filling, we're also susceptible to recurrent decay in that tooth. And so it's not necessarily addressing the issue. And when there is decay in the mouth, that really is a sign of a deficiency in the diet. And so when we're able to address the underlying causes of cavities and then restore our dentinal lymph, teeth remineralize, and then that tooth actually is more resilient to cavities in the future.
Okay, so I was going to ask you, this is kind of a personal question, but I've got 2 fillings that I know need to be replaced because every time I drink my smoothie, a little bit of the smoothie leaks under and I get a little zing through these 2 teeth. But yeah. One of them is a mercury filling, and I don't necessarily want to just have any old dentist go through there and just rip it out. And,
for sure.
And he says it's so close to the root also that I just might need the whole tooth, like, I don't know, taken care of. So are you telling me that there's hope?
But what's that?
Are you telling me that there's hope?
Well, yeah, I mean, yeah. So first of all, we all need to know a really, really good biological dentist, because most of us have work that we need to redo from before. Mm-hmm. Right? So hopefully kids, haven't gone in that deep, but we have like a lot of generations of dental work to either clear up or clean up, that kind of thing. So you really need a top dentist. And even if you don't have one in your area, for this kind of work, it's you might have to travel to get to the best dentist, and I think that's fine, because when you clean up the work and then you get on track and you're following like the 8 steps that we have, which really help people, which really is something you can do before you even go to the dentist, so that you have a better, probably less expensive dental appointment. So you really want to get the mouth in order. The 8 steps are a great way to do twice a day, and we have that on our internet. We have videos, so we have you can email us. We'll give you the 8 steps for free. It's in the book. It's like everywhere. So first of all, you want to do that, and you want to to get the mouth in order, and then you want to find your biological dentist. And then once you've done this work and you've taken care of those 2 fillings, it might be years and years before you have to go back to the dentist, or maybe you'll just need to get a hygienist cleaning every couple of years. You know what I mean? Like, it's once you've remineralized and got the microbiome in your mouth all happy again, you really will be seeing the dentist less. I like to call it how to avoid the dentist without ignoring your teeth. So what generally, mercury, a silver filling is a nice word for a mercury filling. All silver fillings have mercury in them. And silver filling is a combination of silver, copper, tin, and mercury. And it's kind of insane that they're used as a dental material, because they are 50% mercury, and it's implanted just inches from our brain. And mercury, they now know, or maybe they've probably known for decades, it's a cumulative toxin that actually passes through the blood, brain, and placental barriers. So it's also important for any mothers or about to be mothers to clear up the mercury fillings, because it does pass through the placental barrier. And mercury tenaciously binds with tissue, altering DNA, nerves, cell membranes, and mitochondrial function. It's linked to dementia, MS, Parkinson's, and other degenerative disorders. Now, some person might have, 3 mercury fillings and they kind of seem okay, and then another person might have 3 mercury fillings and they're kind of not okay. You could be a number of different issues from Alzheimer's to just depression. And so I think that has to do a lot with, the body's immunity, if you're a methylator or not, like if you can process toxins better. So that's a thing to look at too. You know what I mean? So if you're having sort of downhill things, like it could be the mercury, and a lot of people clear things up. And if you're kind of like, oh, I kind of feel okay. I mean, it's just we all respond differently. And it also depends on how the mercury was put in by that dentist, back in the 70s, 80s, that kind of thing. And so you could have somebody with 3 mercury fillings and they'll do a mercury vapor test, and it's not, it's there. but then you'll do somebody else with 3 fillings and it's like off the charts. So again, it all has to do with our body, but nobody needs mercury in their mouth, and that's one of the greatest sources is from a dental filling. So the actual EPA, the Environmental Protection Agency, claims that the highest body burden of chronic mercury toxicity comes from silver fillings. And a really neat little stat is if just one filling was tossed into a 10-acre lake, it would make the lake unfit for fishing and swimming. One filling in a 10-acre lake.
But it's okay in our mouth.
Yeah, it's okay in our mouths.
Right.
For our mouths and tongues to touch it every day. So both old and new mercury fillings. So there's also that. Well, I had my mercury put in the 70s, and I'm sure it's just inert now. But it actually releases vapors 24 hours a day for your whole life, with a 500% increase in the vapors being released when chewing, teeth grinding, and drinking hot fluids.
So we would all love to know who your dentist is, because I'm sure you've properly vetted them. But for all of us,
I'm luckily I don't have to go to one too much anymore. But I got my mercury out when I was 22, and he was a very good dentist. But I don't think we had all the things in place that a biological dentist would do now, as in air, even a special room with an air filtration unit. Right, and dental dams and vitamin C drips and all kinds of things. So if you don't get your mercury removed properly, you could have more of it in your body. So you have to go to a top dentist. Now, most regular dentists will remove the mercury because, hey, that's a job, right? Removing mercury and putting fillings in. So I have also on our website a list of questions to ask prospective dentists, because even once you get a good dentist, you need to go further, and you really need to see, like, what's their stance on root canals? Do they remove mercury, or are they also putting it in other people's mouths? Because you wouldn't want to go to an office that uses mercury at all. And from the dentists that I really like, they don't even do root canals because they know the dangers and the toxicity are so high. So to find your dentist, you can look at call the Hal Huggins Institute. And but you'll still have to, they'll give you a list of dentists in your area, and then you'll still have to call those dentists. Also, I love Dr. Lena Garcia in Chicago, Dr. Stuart Nunnally in Texas, Dr. Villarreas near Los Angeles area. Those are all really good dentists and really on top of their game. When you get to a good dentist, they will have the top filling choices that are the least toxic, because again, everything that we're putting into our body that's not biologically from a body is going to have the immune system might not receive it, and your dentist will know blood tests to take before and after to see how your body is responding to that dental material. You'll want to use dentists that use things like zirconium instead of titanium implants. Dentists that will refuse to do mercury and root canals, dentists that do biocompatible blood tests to see how that composite will work with your teeth. So we need to know white composite fillings. They also contain BPA, formaldehyde, and aluminum. Porcelain fillings are not 100% pure. They contain nickel and aluminum. So I know it's sad to hear, because I'm sure a lot of people, they're like, I'm going to go for that. They spend the more money.
You think you're doing the right thing.
Exactly.
Yeah, you think you're doing the right thing. That's why I've been holding off for so long.
Yeah.
So
where do you live?
I live in Ottawa.
Oh, you're so close. I don't normally do interviews with people in Canada.
I know. Because I think you're around Toronto, right?
Well, north of it. We're in the woods.
There you go.
Yeah, we're in Haliburton Highland area.
It's beautiful.
Yeah. Oh, it's gorgeous.
Yeah. So I'll make sure to dig out all of those links for the listeners. I'll dig them out and I'll post them on the podcast notes so that everybody has access to this list of questions, because half of those questions I didn't even think of.
Yeah, you can link or even copy the whole article and put it on your site. So whatever you want to do.
Oh, wow. Thanks.
And there is a good, he's learning, he's up and coming, with Dr. Schechter in Toronto. he's made a lot of headway lately. So that's a good local. I mean, he certainly would know how to remove a mercury filling. And what he also does, and what top dentists do. Oh, there's also an amazing dentist in Alberta, in Hannah, Alberta, Warwick. It's a father and daughter team, and they're phenomenal. And they're top of the line, and they also strive to have like the least expensive dentist stuff, whatever you call it, in Alberta. And then another favorite new dentist of mine is Dr. Judine Benoit. She's in Ontario, and she does phone and video consultations.
Oh, that's great.
Yeah, so if you have your x-ray or you have your question, you can call her, because that's actually, sometimes you just need a call. And what's fascinating about her dental history as being a dentist is that she so knows and believes and has seen and witnessed teeth remineralizing that she doesn't fill cavities anymore.
Amazing.
Yeah, so she really is just doing a lot of the phone and video consults. And she comes from a family of dentists. And while her father wasn't necessarily a holistic biological dentist, he did a lot of charitable dentistry with homeless people. And what I found fascinating when I was talking to her is that she found that a lot of homeless people were able to remineralize their teeth. And I found that fascinating because, we think about it in our more, middle class realms, and then we go to the health food store and we're buying our vitamin D and vitamin K and getting our cod liver oil and doing, maybe you're going even more hardcore and you're eating some grass-fed organs like liver and really getting those core minerals back up. Is that she has seen homeless people able to remineralize their teeth. And so I just found that really refreshing. So it doesn't always take a lot of money to redo that. And it's really just good for us to know that our teeth are alive and will change, because I think, how I grew up, I just felt like your teeth, they're grown, they're done. You get a cavity, that's it. It needs to be filled, right? That's sort of what we've all grown up with. What's also fascinating with really good dentists is and Dr. Schechter in Toronto does this as well, is they'll do ozone therapy and plasma therapy as well. So we make an ozonated gel, which is great, and you can apply to your teeth. But if you're going to a dentist, what they'll do is after they do something to a tooth or have it extracted, or if you need if a root canal, maybe there's a root canal that you want to get out, but you can't right now because it's inconvenient or because you're pregnant, right? And you don't want to have a lot of stuff going on with your body, is they'll able to do ozone and plasma injections. And then that will help stabilize, because behind every root canal is lurking a really
something nasty.
Something
nasty.
Infection, yes.
No.
100% of the time. And so now it endodontic, there's a big discussion in endodontic dental journals about the actual impossibility of a root canal ever being sterile. So it was all for decades promoted as, it's a sterile procedure, but it is impossible to sterilize because inside each tooth are 3 miles of microscopic dented tubules. So if the tubules were laid out, that's 3 miles in each tooth, and that cannot be sterilized.
Wow.
Period. So it doesn't get sterilized through the root canal. And then the plasma injections are fascinating, because then at the dental office, they'll take out some of your blood, put it in a centrifuge, a spinner. They separate the plasma out of it, so you get like the red removed, and you get this golden plasma gel, and then they re-inject that into your the area that was just worked on, and then over the course of the next 6 months, that plasma calls in all your healing peptides and all the nutrients that need to really heal that area. And there's also that being done for things like receding gums and that kind of thing.
Well, Nadine, you have taught me so much today. This has been such an awesome interview. And I'm speaking for myself, I'm speaking for the listeners. You have given all of us so much hope about our future dental health and about the everyday things that we can be doing. So first off, everybody should be getting Nadine's book called Holistic Dental Care, The Complete Guide to Healthy Teeth and Gums. And then you should go to the Living Libations website and buy her pack of your dental formulas, your elixirs and whatnot. We didn't even talk about that. Can you just talk about that for a few minutes?
Yeah, absolutely. So, so So we have created so many beautiful formulas, toothpaste and serums to really get your mouth back on track. And if you use those serums with the 8 steps, you'll really see your mouth turn around. And if you've just gone to the dentist or hygienist and they're like, oh, your gum pockets are at a 7 and your gums are bleeding, you're going to need cleanings every 3 months. If you follow the 8 steps and use some of the botanical preparations that we've made, you'll be in such good shape. I mean, people have improved from just little improvements to miraculous. It depends on, if you're going to do it twice a day, that kind of thing. But I also like to say that you can go to our website right now and get the 8 steps and do them all with just salt and baking soda. So I always like to give people that option. You can up your game and you can buy the lovely, totally non-toxic things that we make, but you can also just do it right now with letting go of the commercial products and just adding baking soda and salt to your program.
So Nadine, tell our listeners where they can find your book and your website, where they can get all of your great dental products.
Yes, so the book and all the products are at livinglibations.com. And our book's also on Amazon, so that's really easy too. As you're ordering other things, you can just slip in getting the book. And then also there's lots of information on our website as well, and on YouTube. I have lots of videos that will explain the 8 steps and that kind of stuff as well.
Perfect. So for our listeners out there that are driving in your car or you're out jogging right now, I'll make sure to put those links in the podcast notes so that you can easily find all of this fantastic information. Nadine, thank you so much for being my special guest today. This has just been the most awesome interview I've done so far.
Oh, hey, thanks.
All right, that wraps up this very special episode of the Functional Medicine Radio Show with Nadine Artemis. And I want to thank you, our listeners, for tuning in today. And I'd like to invite you back next week for another episode of the Functional Medicine Radio Show. As always, I'm your host, Dr. Carri Drzyzga, the Functional Medicine Doc. Have a great week, everyone.
You've been listening to the Functional Medicine Radio Show with your host, Dr. Carri Drzyzga, known internationally as the Functional Medicine Doc. Dr. Carri is committed to helping patients find the root cause of their health problems and fixing the cause with natural treatments so they can feel normal again. Dr. Carri is the founder of Functional Medicine Ontario and is the author of the hit book, Reclaim Your Energy and Feel Normal Again. Please tell your friends about the Functional Medicine Radio Show, and we'll see you next week with more from Dr. Carri.